Good morning, everybody. Good morning. Come on, this is a health plan. Good morning, everybody. Thank you very much. It's a pleasure to be here in this beautiful surrounding. Thank you, NYU, and everybody that, my God, there's even a balcony. Fabulous. High up there in the balcony. I hope this is the beginning of many of these community engagement events that we hold. So be sure when you put out your evaluation form, we want to do this again, okay? Because that helps us spend the money for it. So be sure and do that. I want to thank all the people that Dr. Lum thanked, and especially Denise and everybody here at NYU for helping us get this beautiful setting. But, more than that, I wanted to thank each and every one of you for coming, for all of you that are on Facebook listening to us, and especially to the researchers that we're going to hear from today. For those of you that are not familiar with research, it is a pain in the ass in several different ways. One, you have to get the money to do the research. And sometimes you have to fill out applications that are hundreds of pages long. And that's a difficult thing to do, and often you're turned down. And you have to try again to compete and get the money a second or third or fourth time. And then when you do get the application approved by a funder like ourselves, you have to get study subjects to participate. And that is also a very difficult thing to do. And then you have to collect the data. And then you have to write the report. And then you have to give the presentation. And you start all over again because one research paper does not prove very much. It's a body of knowledge that we need to move forward. So I want to thank each and every one of the researchers who work in 9/11 Health that come to us for an application, and the ones that we fund, because it's not an easy task. We're very fortunate in the Zadroga Act, which many of you worked so hard. Thank you very much for doing that. We have $15 million every year that we put out for research. And when you look at the length of the program in terms of how it's authorized to 2090, that's over $1 billion of taxpayer money that is devoted to 9/11 Health research. And we're just at the beginning of that research pathway. And it's going to be extremely valuable for all of us to hear where we're at today, but also as we go through the years, for a couple reasons. First, our research helps improve the care to our members, survivors and responders. But more than that, the research pushes our knowledge base forward. So we're able to take those statutory conditions, health conditions that we were given permission to cover by the Congress and say, well, we have sufficient research to add another condition, to cover this new condition. But we have to have the science, and that's where the researchers and people like you that serve as study subjects come in. It is all of our role to push those frontiers. Otherwise, the program is static. And it remains like it was when the bill passed in 2010. But for the next 75 years, we may learn a whole lot about the chronic conditions that arise from 9/11 exposures. So we're all a community of researchers, really, working towards the dynamism that we need for this program. So that's my way of explaining how valuable it is to hear from our researchers today. We are privileged in the program to fund all of the researchers who apply to us with good applications. We hope they continue to do that for the length of their career. We hope that you'll start recruiting other researchers to apply for our grants to push the knowledge base forward. It's a tremendous opportunity that we all have to participate in research. And I want to thank the researchers today who are going to present their findings. It's an impressive activity that we have in front of us over the next 75 years. And I think that one of the things that I wanted to do in today is to be able to thank all of you who got us to the 75-year mark. It has been a struggle, to say the least. And some of you have struggled for years, and I thank you for that. But the program is in good shape. We have our challenges, which we're trying to meet, and I want to thank everyone in the program who's here today for their work in the program, because without them, my job would be impossible. So thank you to all the folks at NIOSH who are here today. Thank all the researchers. Thank all the members, survivors, and responders. And I hope that you have a wonderful day. If you ever have a problem with the program, you know where to find me. Reach out, send me an email, contact us. We want happy, healthy members. Thank you very much.